Benjamin, and I'm going to do the cervical spine management study at the Han, and this is our one-shot video. So today, yes, we're going to do the cervical spine management. The cervical spine management is used to exclude any vertebral basilar insufficiency and any problems with the high cervical ligaments, so that there is no risk when you are doing the cervical spine manipulations. There are 8 symptoms that come up with patients that have problems in those areas. It's the 5Ds and 3 Ns. The 5Ds are dizziness, drop attack, dysphagia, dysarthria, and dyslopia. The 3 Ns are nausea, numbness, and nystagmus. Before you start, you also want to ask the patient, is there any history of trauma, if there's any recorded history of ruptures or fractures in the high cervical spine, also if they have Down syndrome, which would interfere with cervical spine management, and also these tests. The first test we're going to do is the vertebral basilar insufficiency test. We're going to ask the patient to lie down with their head on the back, head up back. And raise the bench. And with this test, you are testing the blood flow of the vertebral basilar arteries, which can also cause the symptoms. You're going to support the patient's head on the bottom, and you're going to ask the patient to slide with it until their shoulders come off the back of the bench. Thank you. And you're going to, while supporting the head, you're going to put the head into extension as well as rotation. If you are testing the left artery, you turn into right rotation, and you ask the patient, do you have any symptoms? Looking for the eyes as well, keeping the eyes open for any nystagmus. How are you doing?
Good.
Alrighty. And then for the other artery, you want to rotate the other way, so extend it and rotate to the left, making sure the patient's eyes are open. How do you feel? Great. And then you can return the patient back to the bench, supporting the head at all times. The next test we're going to do is the tectoral membrane, anterior tectoral membrane. This membrane is attached to the occiput at the anterior side of the foramen magnum, and with this test, it's a provocation test, so when this is happening, you ask the patient if there's any symptoms of the 5Ds and 3 Ns. To do this test, you want to grab the patient's head, one hand fixating the C2, and the other hand holding the base of the occiput, and the shoulder resting on the forehead of the patient. To apply the test, you create a high cervical traction with also high cervical flexion, as to increase the intensity on the tectoral membrane. During this time, you want to ask the patient if they have any of the 5 or 8 symptoms.
No.
Great. You want to move on to the anterior shear test, which tests the integrity of the transverse ligament that connects from the lateral masses of the C1 and holding the dents in place. When applying this anterior shear test, you want to find the transverse processes of C1, and then putting your middle fingers more medially of those, you want to apply an anterior pressure as to create tension in the transverse ligament. If the patient has any symptoms, they should let me know, as well as making sure the patient's eyes are open to watch out for any nystagmus. Fourthly, we're going to do the sharp purser test, which is also for the transverse ligament. The patient can sit on the side of the bed for me. Thank you. And I'm going to drop the table. The anterior pursor test, also, the sharp pursor test, also test for the transverse ligament. So you want to grab the patient's head between your arms, fixate the C2. You want to create high cervical flexion, which creates tension on the transverse ligament. If there's any symptoms of the 5Ds, 3Ns, the patient will let me know. And then when applying posterior pressure to the occiput, to the skull and to the C1, it should relieve those symptoms. And if those symptoms are caused and then relieved, then it's a positive test. Last test is going to be the ligament to alarum test. And with this, it's not a provocation test, it is alone a testing of the integrity of the ligament, so looking for the end field. To do this, you want to fixate C2 with the lumbrical hold, which is with your thumb and your golden point on C2. And to create tension, you want to rotate the high cervical spine, and then this is for the left alar ligament of the patient. You want to create high cervical lateral flexion, contralateral to the rotation to release tension of the ligament alara. And then you want to create more rotation again to increase in tension on the left alar ligament. You are looking for a hard, springy end feel, such as a ligament. If there's a soft ligament end feel or something different than that, then you know that the integrity of the ligament alara is not there, as well as you would also do the test for the other side. And that's cervical spine management.